Welcome guys, today is an interesting topic. I discuss about the urinary retention, the types of urinary retention, the signs and symptoms, the causes of urinary retention, and what you need to do if you have a urinary retention. Stay tuned, and if you are new, kindly subscribe to get more of these health videos. Now, urinary retention. This is the inability of the bladder to empty completely. Now, there are two types. We have the acute and the chronic urinary retention. In acute, this is a sudden onset, and it lasts for a short period of time. In acute urinary retention, one can't urinate. One also may have the pain on the lower abdomen, pressure on the pelvic. So you need to go to the hospital if you have all these signs so that you may get the right management. The other thing is a chronic. In a chronic, this is something that has been there for a long period of time. Now, one can urinate. However, one can have the signs and symptoms of urinary retention. One is the frequency to urinate. The other thing is the urgency to urinate. The other thing is ecstasy. There is a cutoff flow of urine. The other thing is a pain, tenderness, and what we call the pressure on the pelvic. So these are signs and symptoms that one can have in chronic urinary retention. Now, there are various causes of urinary retention. One is obstruction. If you have obstruction, secondary to the tumors, that can affect the urine outflow. Like if you have the tumor of the benign prostatic hypertrophy, if you have a prostatic cancer, this also can cause what we call the obstruction, which can cause urinary retention. The other thing is the urethral stricture. If you have the narrowing of the urethra, this also can cause what we call the urinary retention. If you are constipated, if you have trauma to the pelvic or what we call to the urethra, this also can lead to urinary retention. If you have stones, the kidney stones, this can obstruct the urine outflow. Now, number two cause is what we call the infection and the inflammation. Now, if you have the infections that are caused by bacterial infections, such as sexually transmitted infection, the urinary tract infections, this also can lead to what we call the urinary retention. If you have an inflammation of the urethra, urethritis, this also can cause what we call the urinary retention. If you have prostatitis, if you have cystitis, these all infections and the inflammation can lead to what we call urinary retention. Now, the other cause is medication. Now, the medications that we take are normally for maybe treating of various conditions. The prescribed medications can also lead to what we call urinary retention. Such medication, such as the non-steroidal anti-inflammatory drugs, such as the ibuprofen, it also can lead to what we call the urinary retention. The other thing is anticholinergic medications. Maybe you're taking medication this also can lead to what we call the urinary retention. Now, the other cause is neurological. If you have conditions that are affecting the nerves, so there is no message, that there is no signal from the brain to the what we call the bladder for the opening and the crossing of the sphincter. This can lead to what we call the urinary retention. Such condition of stroke, diabetes, the spinal injury, if you have disc herniation, these all condition of that can affect the central nervous system can lead to what we call the urinary retention. The other thing is what we call the if you have undergone what we call surgical, maybe you have undergone surgery, maybe for tumor removal, maybe hip replacement. This after surgery you may have what we call the urinary retention. So these are various causes of urinary retention. Now, you need to go to the hospital so that the doctor can examine you. The doctor can send you for some of the investigations, the urinalysis, the urodynamic tests, the blood tests, and also the imaging. You do the computer tomography, the ultrasound, so that the doctor can come up with what might cause this urinary retention. On the management or treatment, it will depend on the cause. If you have urinary tract infection, the sexually transmitted infection, you're gonna be given antibiotics. If you have tumor, you're gonna maybe be given surgical may be done so that you can get out of this tumor. So the treatment will depend. So maybe you're gonna need what we call the catheter. You're gonna be catheterization gonna done for you so that you can get the urine out of the bladder. So there are various management that one can be given that will depend on the cause of the urinary retention. So this is the end of this discussion. Share this information with anyone you think he or she can benefit from this health video. Like, comment, leave a comment, let me know what you need me to discuss in the next topic. Thank you for staying tuned. See you in the next topic.